Hi there, I'm Dr. Augustine from the Fast Pain Relief Center here on Grand Island, New York. And I'm really glad you found our website on irritable bowel symptoms. You know, if you've had irritable bowel syndrome or even any other severe digestive problems, you may be able to get some help. And, you know, I can tell you from suffering with IBS, it's a miserable disorder because it really affects everything that you do, whether it's your job, your activities, your social life, things like that. It's miserable. You know, it really puts a damper on things because you got to stay close to the bathroom. And it's embarrassing as well. I just had a young girl today that I saw, she's 32 years old, that has been diagnosed with irritable bowel syndrome for a number of years. And what she told me today was, you know, the last couple of days have been miserable. In that in the course of 24 hours, she's literally had to go to the bathroom, stool movement, 24 hours, 17 times she's had to go. I mean, very abnormal. And maybe you're not to that extreme, but you know, you have those irritable bowel symptoms. And the chronic running to go into the bathroom. And you maybe don't know even when it's going to hit. But if that's you, you've probably been through a slew of testing. You know, you've had the endoscopies and colonoscopies and ultrasounds and all kinds of blood work. And just like the lady I was just telling you about, they say there's nothing else we can do. You know, live with it. And she doesn't want to accept the fact, and I don't blame her. And that's why she came into my office. And those are the patients that I just love to see, because those are often the patients that I can help. People that have been every place. Again, they've taken medications, they're sick of, tired of feeling like that, and they want some answers. And believe me, you can do, again, a slew of tests and not get any answers and just be told that everything's normal, yet you still continue to suffer with irritable bowel symptoms. You know, who wants to deal with that the rest of your life? You know, that girl that I was telling you about, she's only 32 years old. Imagine going through your life and living with that every day, day after day. You know, there's no need for it, frankly. You know, and half the tests that I told her or asked her that, you know, did you have this test, did you have that test? She didn't have any of it. Yet she went to the, you know, top specialists. She went to all these procedures getting done, yet nobody is doing anything for her. Again, that's why she's in my office. You know, so if that's you, if you are suffering from IBS, severe digestive disorders, problems, maybe even reflux and things like that, you know, those are some key things that need to be handled and key indicators that there's a problem going on, you know, within the body. You know, the lady I was just telling you about, the 32-year-old, one of the first things, she brought in some blood work. And one of the first things that I saw that kind of raised a red flag for me was that her white blood cells are really low, which can suggest an infection. Now that's outside of, you know, usually what I do, but we can send her to the right person, doctor, to get that under control if there is a problem there. You know, she didn't bring in enough information. So, you know, if you've had all the testing done and you've been told that it's normal, there's probably, you know, a good reason why you're still having problems. I'm going to share with you this one little thing that just blows people away that many times people don't know. 70% of your immune function is from your large intestine, your gut essentially. So 70%. So a lot of times what we'll see is that a person has an immune dysfunction that's causing a lot of the irritable bowel symptoms. And you don't know unless you particularly get tested for that. So, you know, if you're interested in this, one of the things that I do is I offer 2 free visits to patients. You know, people just like you that are suffering with IBS or digestive disorders and don't know really where to turn. And the reason I do the testing is it allows you to see what I offer, and secondly, to see if you can even be helped out. There's some people that it's too far gone and you may have to stay on medications for the rest of your life, or as some of you may have been told or expressed, you may have to live with it. You know, if it's too far gone, you didn't act quick enough. So please don't let that happen to you. You know, the sooner you can get this analyzed and get tested to see if there's possibly some help, you know, the better it is for you. So to take advantage of those 2 free visits, here's what's going to happen. You just need to fill out that form with your name, your address. It says 2 free visits on it. somebody from my office will contact you and set up an appointment. Or you can call us directly, 716-773-4707, and tell whoever answers the phone you saw us on the internet, you want your 2 free visits for irritable bowel syndrome or digestive disorders, and that allows us to see if you can even be helped out. You know, don't waste any more time. You know, now's the time to do something about it and get your life back. You know, talking about that again, the 32 years old and really can't do much. Please don't let that be you. You know, I've seen too many people that, you know, they've resorted to, you know, pretty much staying at home because of this problem. That doesn't have to be you. You can resume your normal activities, your hobbies, if this can be helped. So again, I'm Dr. Augustine from the Fast Pain Relief Center here on Grand Island, New York. Hope you enjoyed this video, and if you have any questions, you know, email me. I'll actually answer your emails. Believe it or not, it may take a few days, but if you have a quick question, I will be more than happy to answer that for you. And that's what my office is all about, giving you the information that you need to make an informed decision, an informed choice about your health care. Have a great day, and God bless.